So I am happy to introduce Rosa Herrin and Samantha Eurake from the the Louisiana Language Access Coalition. So I'll let them take it away.
Hi, my name is Rosa Herrin, and I am the co-chair of the Health Committee for the Louisiana Language Access Coalition, which is a volunteer-run effort.
Hi, and I'm Samantha Iraqi, and I am a part of the Health Committee also for the Louisiana Language Access Coalition. And like Rosa said, this is all volunteer, so we both have separate jobs that we do. So Rosa, did you want to talk a little bit about what you do also?
Oh, well, yeah, I am the Gulf Coast Policy Officer for Oxfam America. So I work in Mississippi, Louisiana, and Alabama, promoting workforce development initiatives connected to environmental justice as a result of the BP oil spill and the Restore Act that was passed in 2012.
And I, in my day job, work with the HIV cancer care program in Louisiana. And what we do is try to better coordinate care for people that have HIV and cancer. So we provide patient navigation and better coordinated care between infectious disease doctors and oncologists.
Okay, next. So the Louisiana Language Access Coalition promotes full and meaningful participation in public life without barriers based on language for all people. This was a result of Hurricane Katrina. After the hurricane, the Latino Forum was created as a place for different service providers and advocates to come together and share resources and learn from each other to avoid duplication of services, but also to better serve the Latino community. And through the Latino Forum, the issue of language access was identified as one of the main concerns at the time and until today. So the Louisiana Language Access Coalition was formed in 2006. The idea was to bring together community members of the New Orleans metro area from the Latino and Spanish-speaking, as well as Vietnamese and Brazilian and Portuguese-speaking people, which are the largest groups of immigrants that speak other languages other than English in Louisiana. And the idea was to address language access. Okay. The idea was to address language access issues in public policy, work with public agencies, community organizations, to have better public services for the limited English proficient population. Since 2006, the coalition has focused on the areas of healthcare, criminal and civil justice, and education, as these are the areas that affect the LEP population in service delivery and rights as provided by Title VI of the Civil Rights Act of 1964. Next. So why language access? We believe that people should have a right to receive services in their preferred languages, and that language access not only is a federal priority, but it is, from a community perspective, a very much needed service that we encourage and we advocate for in Louisiana. So I'm assuming most of you know that a LEP refers to a person who is limited English proficient. Next. So here are some pictures of some of the events. We do an annual breakfast where we bring together community members and advocates to kind of celebrate what we've accomplished every year, but also to have a more strategic planning of what things need to be done for the following year. Next. So you might be LEP if you have trouble reading, writing, understanding, or speaking English. So we come from the perspective that it is not easy for LEP people to talk in English with doctors, nurses, attorneys, judges, social workers, and other service providers. Also, if you do not know English very well, you may not get the services you need in this area. So sometimes you might even get care services based on the wrong information. So a lot of what we have observed is people in different healthcare and justice settings either not getting the services they need or getting the complete different, or getting services that do not address their needs because they are not, because of the language barriers and because of issues with interpreters that are not qualified to provide the services in these different public settings. So the question, if you are an LEP person, what kind of special rights do you have? So as many of you may know, there are many protections for LEP populations under the Civil Rights Act of 1964, specifically under Title VI. Next slide, please. So the Title VI gives some special rights to LEP populations. So it basically states that certain agencies that get federal funding have to follow certain rules. These agencies must make sure that you can use their programs and services by having language services. So the way Title VI operates is basically the public agencies that are receiving federal funding have to provide language access for the populations that are represented in their communities. So in the case of Louisiana, like I mentioned before, the largest non-English speaker communities are Latinos who speak either Spanish or Portuguese, and the Vietnamese community that speaks Vietnamese, of course. So those are the three languages that we push for, and we advocate for all agencies receiving federal funding to include in their budgets language access and translation interpretation services, but also to be mindful and aware of the specific needs of this community. So if people cannot get the benefits or services from one of these agencies because they are LEP, it could be considered a form of discrimination, and they could have a legal precedent. Discrimination is when you're treated differently or badly because of the color of your skin, where you're from, or because you have an accent. And as you know, there are many other elements that constitute discrimination in this country, but we focus on the issue of language access. Now, we, as a coalition of more than 20 organizations, we have always tried to first work with the agencies and in different ways, employing different strategies to work with them. And then we have only supported litigation through other partnerships when there is no other recourse. So after we try everything in every possible venue to get an agency to provide language access, if they continue to refuse to do it and we cannot get to any kind of agreement, then we will support efforts like the recent lawsuit that was filed by the Southern Poverty Law Center against Jefferson Parish School District because of issues of language access and discrimination. Next. So what do these agencies have to do for me, and why is this even important? So as you know, public agencies provide many services from healthcare, justice, and education. And these are services that are needed for all people, and especially in our communities. These are critical services that most people are afraid to even attempt to get, or when they do try, they face so many barriers and obstacles that sometimes get discouraged to even trying again. So it is important for the coalition to ensure, and this is why justice, education, and healthcare were chosen as the three major areas of concentration, because we believe those are the three areas, the three services that people need the most and where language access needs to be incorporated and promoted. Next. So we believe that these agencies have to do their best to do three main things for LEP persons. The first one is provide free interpreters, but these interpreters must have special skills in helping you talk to someone who speaks only English. So in this sense, we are very much against people using family members, especially children, to provide interpretation for many concerns that I'm sure Samantha can talk about in more detail regarding confidentiality and accuracy of the information. But also we are very much promoting the use of certified and qualified interpreters. So because being bilingual does not necessarily mean that you can provide accurate interpretation. So we encourage public agencies to use certified interpreters, and we have a network, extensive network of interpreters that we can refer that do this for a living. These are professional interpreters that we refer to public agencies for them to use as needed. The other point is translating all important forms into different languages, in this case, Spanish, Vietnamese, and Portuguese. Specifically, for instance, applications that are applications for benefits or services that are in English need to be translated into different languages, and other important documents that provide education and vital information for people. Next. Well, I mentioned about the applications. Make sure that you know that you can get interpreters and translated material. So we also ask for agencies to let people know that they can ask for translated materials and that they can ask for interpreters. Although in many cases, because of funding limitations, a lot of these public agencies are using the phone line for interpretation, which is not the best option, but in some cases is the only option. And so we understand that, but we're always pushing for the use of actual people for interpretation and no computerized services. And so we ask them to have signs and telling the community about different language access opportunities on their sites. Okay, next.
Hi, and now this is Samantha. I'm going to be taking over from here on. So Rosa did a great job of starting to talk about, or actually talking about Title VI, really. And I think sometimes we get bogged down into this idea of who's supposed to be following Title VI as if it's something difficult to figure out. But the truth is that it isn't, because any agency that gets money from the federal government must follow this law. And I also, in the little chat area, I put a website. Maybe it's letting me. Broadcast to all. So I'm putting the website that if you would like to go look a little bit further into Title VI, you can. But really any agency that receives federal money. And I think sometimes people might be surprised by that because they think, well, I'm working for an agency and I didn't know that we were supposed to do that. But really, if you dig, any public agency, certainly, like the police or state agencies like the Department of Social Services or DHH, nursing homes, domestic violence shelters, and certainly any CBOs in your area have to follow Title VI. And so these groups cannot treat people differently based on where they are from or the color of their skin or their language. So I think at least when in starting this and starting to volunteer with the LLAC, was really surprised that it was that broad. So what should you do if an agency will not give language services? And I think that's the reality that all of us deal with, and I'm sure y'all out there could give many stories of people not being provided services appropriately. So you can try to tell them about Title VI. Sometimes that's a difficult conversation to have on the ground level. So I think this is really where you can try to engage your organization and say, as an organization, we also can look within and know now that we have to follow Title VI, but also as your organization works with other organizations, saying that we should all be able to do this. And one example that I have of that is here in Louisiana, at least, with some of the state regulations, they will say that for their state funding, you have to be able to provide ID. And that really deters and creates a major barrier for our patients or clients that aren't documented. And so we finally figured a way around it, and it was really about the computer system, because we had to make sure that because the agency was receiving federal funding, they should have been able to provide patients with care under that federal funding. But they were saying initially, we can't because we get state funding and you have to provide an ID. So we had conversations with that clinic about that, and they were able to figure out how to put them into the system so that they didn't fall under the state funding. Instead, they were falling under the public federal Ryan White funding. Now, that's not to say that the clinic then was automatically capable of providing services to LEP patients, but that's just the first step. And so I think really when you're thinking about your agency, it's not about automatically saying we're going to start to provide services to LEP patients or clients immediately, but really taking those steps to work towards that, because we also don't want to be doing a disservice to them by saying we can provide services for you appropriately and then not be able to. So sometimes this can work a lot slower than we would like for it to work. So I think that's the next point. If a caseworker employee will not listen, ask to talk to his or her boss. Sometimes these discussions do have to occur with some people that are higher level because it really has to be a change in the system. And I'm sure a lot of y'all can attest to feeling like we are filling in for the gaps in the system as caseworkers or as navigators. And really that's not the way that it should be. I mean, we do what we have to, but ultimately it really should be a systematic change within your organization or others. And like Rosa said, I mean, we try to leave litigation as being the last option. But if the agency won't listen, you can always call the Office of Civil Rights and put in a complaint. And the truth is that they need those. I think as an organization, as LLAC, and as the Health Committee, we're always talking about trying to get those stories on paper and trying to really get those complaints in. Because as we know with a lot of with our patients and clients, they don't say much. They just stop going and stop receiving care or treatment, and then they don't really tell anyone about it. So I think sometimes that's really what advocacy is about, is letting them tell their story and not really having us do it, but let them do it. So those are all the things that you can do. And then when we really talk about interpretation, like Rosa said, we really shouldn't be using family or friends as interpreters, especially when we're talking about HIV and AIDS. I know of numerous stories where confidentiality has been breached because of that. If someone says, oh, I'm this person's friend, and talks to the nurse, and then the nurse divulges that information, that is a huge breach of confidentiality. And it happens. It happens all the time because we don't have great interpretation services. Also, and this sounds terrible, but people are just curious. And so when you bring someone in that's your friend and they're curious to hear what's going on with you, then they ask questions that maybe they shouldn't be asking. And as a patient, if they don't know that that's what's being asked, then they don't even know that confidentiality has been breached. So we really need to be careful about using friends or family. In an ideal world, we would never have to use them, but the truth is there are a lot of times no way around that. And so, is that? And so if you have to use it, I would really, as advocates for the patient, just let them know if you're there or if you talk to your clients or your patients, tell them, if you're going to take someone somewhere, you have to make sure that you trust that person with any information possible, because that can happen. And so you want to make sure that you're taking someone that you really do trust. But you should really be careful because they don't necessarily have the skills needed to be an interpreter. They don't know how to do interpreting. And the LLAC, for a time through another organization, NOLA, we had been doing interpreter training. So it really is a skill, and it's a special skill, and it works really well when done correctly. And there are certain things like triangulation, in terms of interpreting and making sure that the provider is looking at the patient. And that can be really difficult because oftentimes the provider just wants to look at the interpreter. And that really isn't ideal because then the provider and the patient aren't making a connection. And even though they can't understand each other, it's still important for that connection to be made. And then they may not understand all the words that are being used. So there's a lot of medical and legal terminology that would just be too difficult for someone who doesn't have that background to really try to explain. And you might be shy about saying, the patients might be shy about saying what's really going on with them. And so unless you have someone that's really able to push the patient to talk about what's going on with them, I know medically at least, sometimes they don't want to say, oh, I've had fever every night for the last 3 nights. And your friend or family member, might not be willing to say that because they're trying to protect you or feel like if that's something you don't want said. But as an interpreter, of course, you wouldn't say anything that the patient doesn't want you to say. But if they're telling you that, then that's something that needs to be information that needs to be passed on to the provider. And I've seen that happen quite often. So again, try to use an interpreter rather than a friend or a family. And this isn't ideal, and a lot of times they'll use phone lines, which don't work properly. So on my end at least, I've seen providers just as frustrated as patients. Providers who want to be able to communicate with their patients but try to use the phone line and no one's there, and it takes a half hour to get someone on the line. So again, this is where having conversations with, with these larger entities, it can really be difficult. But having conversations about the fact that it has to happen and continuing to push the issue is at least what I've found that I continue to do. And really, health workers, if you're there, it's important to tell them you should not be giving this information to anyone else unless there's expressed permission from the patient. And I think sometimes the health providers don't even know that. They think, oh, someone's here with you, then I can just give them all the information. But they really need to make sure that the patient has given that permission. And like I said, if you're in some sort of medical emergency, these things aren't ideal, but you're really trying to make sure the patient is taking someone that they trust there with them, because information can be divulged so easily, and it really is a problem, because that can really create problems for how the person manages their disease. I know one example where a patient, their information was divulged to somebody who doesn't really know anything about HIV, and then told the patient that they were going to have to wash everything with bleach and that they needed to be separate from their children. And this, especially for somebody who's recently diagnosed, is a terrible, terrible thing to tell them, because what they need is family support. And if their family then is beginning to marginalize them, then of course that doesn't bode well for their HIV care and to keep them in care. And so having someone come in who can really explain that can really turn things around for the patient. So that's why, as much as we can, we need to be telling patients that they don't want to use family and friends. And although it's not ideal, I've seen the language line work. When someone can be on the phone, it works, and you can communicate somewhat effectively on the language line. The most important thing, and I think Rosa said it, and I'll say it, and we can keep saying it, and I know sometimes it'll still happen, but you really should not be using children as interpreters. It is entirely too much of a burden. Children don't understand what's happening, and it can be really, really difficult, and you won't be getting the correct information. It's difficult even in the best of circumstances to really be able to communicate everything effectively, and certainly not with a child. So as much as you can, if this can be avoided, it needs to be avoided. So our goals as LLAC really is to promote public policy on language access for LEP people. And that can take many forms. I think that in LLAC, since it really is a volunteer-driven organization, we in our own roles, I think, do our best to try to advocate for our patients and have the knowledge and be able to give that knowledge to other people about Title VI and about things that should be happening. Again, increasing the capacity of public agencies of your own community organizations is important, and it's one way that LLAC tries to advance our goals. Create responsive public services that are sensitive to the needs of LEP people. I'm sure, again, a lot of you can attest to people just not being sensitive. And a lot of it is that a lot of people are overworked and they don't feel like they have the time. And so that one extra step that they have to take in order to communicate with a patient that doesn't speak English is just too much for them. And sometimes I joke that I think sometimes agencies need a training to just be reminded that people are very sick. And so that extra step really isn't an extra step at all. It's just what needs to happen in order for that patient to get well. And we really try to promote an inclusionary environment for all people. I think sometimes we can get so focused on one specific population, and I think with the LLAC we really try to make sure that it's about limited English proficient people, not just one certain population. So what are we doing? Some of the things that LLAC does is that we do strategic planning, like Rosa had mentioned before, and this is a picture of that. We also focus specifically on proposals to the state legislation and provisions that create standards and monitoring of interpreter services within the state court system. I mean, this is a hefty load, but it's something that we keep trying to do. In health especially, we try to make sure that there's Medicaid reimbursement for interpretation because that is something that they are supposed to be able to get. Adoption of state standards and provision of language-appropriate services in healthcare, including medical interpreter standards. And I think that's where we run into difficulties where, there might be an interpreter, but we aren't sure of the standards. And on a national level, people are working on this also, but a lot of places have had more success doing this on a state level. Increased awareness in the healthcare community about laws, resources, and skills for providing language-appropriate services to LEP individuals. And I think this is really where it's about just knowing and having the knowledge and being able to provide that information to others can really go a long way and can really maybe be that first step for an agency in knowing that that's something that they have to do and that they might be able to do, especially with things like Medicaid reimbursement. In education, we've continued to work with the charter school system and the RSD here to raise awareness of the needs of of the LEP community. So we continue to advocate with leadership in the city and in the state, really. So in terms of working on interpreters, state legislation and provision that creates standards and monitoring of interpreter services within the state court system. So I would say probably the court system is the one that has the best standards, or at least some. And if we can work on that and expanding that, I think that's been what we've talked about with an LLAC. If we can continue to expand that, then hopefully it'll start to bleed over into some other areas. And again, in working on healthcare, Medicaid reimbursement for interpretation would be ideal and would really help agencies to sometimes do what they already want to do, because I think some agencies really just don't know how and would like to be able to provide more of these services. And again, I think one main thing is that third point of increased awareness. If that's something, if that is what we can do at the stage that we're at, then that's still a big step, I feel like. And I know that working in this field and seeing the kind of services that people can be provided, to me, that's a huge step. I know that I wish that we were further along, but I really think that that is a major step to take if people can at least be aware. And this is our contact information. And if y'all have any questions, we can open it up for questions.
So I have muted some of you all's lines, so feel free to use the chat section, but I will unmute those lines just in case you wanted to ask a question out loud. And so I have a question for Samantha. And Samantha, how have you seen dangers in the way people use their medications because they did not understand either the pharmacist or the doctor's instructions?
Absolutely. So making sure that the medication is given with that it's in Spanish is major. So if that's not happening, that's definitely something that the pharmacy should be providing. So again, that's definitely a conversation to have. And actually, I will say that's one of the things that I've seen happen most consistently, that they are given the medications in the language that it needs to be in for the patient. But yes, we all know, for those of us that work in HIV, that medication, especially for HIV management, is incredibly important. And so, we as patient navigation that we provide for HIV and cancer, especially where there can be interactions with the medications, having it written is important because I think when you reiterate these things with patients, sometimes we have patients that can't read or write either. But for those that can, when you have to reiterate this is how you need to take it, and showing them the pill bottle, that goes a long way. So again, this is why you really don't want to use family or friends because they don't really know what that means or how important it is to take it every day. So this is where things can get lost in interpretation, is if the doctor tries to impress upon them the importance of taking their medication every day and that adherence really is about taking it every single day and not missing a single dose. Someone might say, oh, you have to take it every day and that's important, but that really doesn't convey the message of how important it is and imperative it is that people take their medication exactly the way it's prescribed. So absolutely, that's a really great point, and also why it's important to make sure that you're getting someone that knows what they're talking about in terms of HIV to interpret.
Judy?
Yes.
I have a question, and it is these guys are in Louisiana.
Yes.
And that's great that somebody can go to them over there. Is there a similar organization here in North Carolina where people can go to when they encounter this problem?
No, and to be honest, as far as the LLAC, I mean, we have people contact, and again, it's organizations if we're trying, like Rosa said, we would support, litigation or something like that. But really it was just us, as a group that said, we think that this is important. And so, I mean, I would, encourage you to get together with other people who you think feel the same way, just to have a group that if y'all need to send something into, looking at the website and having the Title VI information, and then going to put in complaints. The number is there, and I can actually go back to that slide so that y'all can see.
Right, and I think one thing to reiterate is that the Language Access Coalition is just volunteers.
Right.
Who come together and maybe evaluate policies of different clinics.
Right.
And, many of us already have so much work that we do with the community.
Right.
That we know of these things, but oftentimes the space isn't there. So if anyone in the South has issues with language access with clinics, you can send those my way, and we'll try to find a way to include those in the policy recommendations that we make.
Right.
Yes.
And anyone can call this line. I do want to point that out. This isn't about a specific organization calling, but anyone can call this line and make a complaint.
Right. I just wanted to know if there was a similar group here.
Not that I know of. I don't know if Rosa knows of anything, but
no, I don't know anything in North Carolina. But I just wanted to say, it is true that this is a volunteer-run effort, but we do, when we recruit people to be part of the executive committee, like Samantha and I are, we look for people who are already working in this field, so it doesn't feel so much like it's added work. So Samantha is working in healthcare. Therefore, it makes sense for her to be part of the healthcare group for the Language Access Coalition. And we also have a memorandum of understanding that we have between the coalition and the agency. In this case, it would be LSU, where Samantha works. So there is a memorandum of understanding. So the agency will also know that she is doing this work on behalf of the agency, but also for the coalition. And she will be able to have this as part of her work, and like I say, something added. And then it's also having the MOU is a way to hold people accountable for the things that they commit to for the coalition.
So we have time for a few more questions. I'm not sure if anyone else has a question. Yeah. No? So I just want to kind of reiterate, for people living with HIV, just how dangerous sometimes not having the proper information. Many times medications for people with chronic illnesses cause issues across the board, and so if people are not able to communicate with their providers and let them know what is going on in another area, they may be prescribed medication that interferes. They may not get the appropriate dosage. They may have some toxicity, or they may need additional therapy, prescription therapy. So this is a really great topic, and I want to thank Rosa and Samantha for taking the time to talk to us about it today. If anyone has any additional questions, they have a really comprehensive website about the things that they do, and you can also email them. If you would like to present a webinar in 2015, if you have ideas for that, or if you want to request capacity building services or learn more about the Latinos in the Deep South program at the Latino Commission on AIDS, please feel free to contact me, and my information is on the screen. Thank you so much, everyone.
Thank you.
Thank you.